pain in your hand and wrist? Maybe it goes up your forearm, or it might be in your thumb. Well, there's a chance you might have carpal tunnel. Today, we're taking a closer look at the signs, symptoms, and treatment options with Dr. Michaelia Sunderland, hand and wrist surgeon with TSAOG Orthopedics and Spine.
Thank you for having me.
All right, so for those who may not know, what is carpal tunnel?
Yes, so carpal tunnel is a condition where you have a pinched nerve at the level of the wrist. The median nerve, it runs from your spine down your arm, and it runs through a tunnel called the carpal tunnel, and it tends to get pinched there at the wrist. It's the most common place for that nerve to get pinched at. Symptoms include numbness, tingling, and hand pain. And it can be made worse by repetitive activities.
And so who can get carpal tunnel?
Yes, that's a great question. Anyone can get carpal tunnel. It is seen more commonly in women. It can be seen in patients with conditions such as low thyroid, even during pregnancy. It tends to get worse as we age, and so it's more common in those who are a little bit older than in children. It can also occur after acute fractures or dislocations of the hand or wrist.
And you mentioned just a few of the symptoms, but what are some other symptoms that would, indicate that you probably have carpal tunnel?
Right, so the first symptoms, it starts to feel like your hand is falling asleep. So numbness, tingling in the fingers. As it gets worse, it progresses to hand pain. It's pain that often can wake people up at night from sleep due to the severity of it. Something that it should get better when you change or adjust the positions, but when it doesn't, that is an indicator that it's getting worse.
And so what are the treatment options? Because if it goes untreated, it will just get worse, right?
Right, absolutely. So avoiding the activities or the repetitive motions that are making your symptoms present. So changing position when you start to feel it, doing some, we call the medium nerve glides, some stretches that help to alleviate that pressure and hopefully help to relieve the symptoms you're experiencing. People can also start wearing wrist splints at night to help relieve that pressure on the nerve to restore that blood flow to the area. But once the symptoms stop responding to the conservative measures, that's a time when you should seek medical treatment for evaluation, and potentially may need an operation for the condition.
So that's when you definitely want to go seek out a doctor and some help. So
absolutely.
You mentioned kind of repetitive motions or activities. Yeah. What are those kind of day-to-day?
Yeah, well, I have some people that work in a bakery, and they describe certain repetitive motions that they use their hands for that provokes their symptoms. I know I can give myself carpal tunnel when I help move my sister, and she's got too much stuff. So, it could be something that you do every day, or sometimes something you do every once in a while. Other activities, some people experience it with typing from the extension of the wrist. Trying to modify that position with ergonomic keyboards, mouses may help to buy you some time.
All right, anything else folks need to know?
If symptoms keep getting worse, come see me. I'm happy to get you tested for it and see what the next steps are.
So. All right. Thank you so much, doctor. Remember, TSAOG is your one-stop shop for all your orthopedic needs, from diagnosis to recovery. And they have 8 locations in the San Antonio area, and Dr. Michaelia Sunderland practices at the Ridgewood Medical Center and Schertz locations, and you can book your appointment by calling 210-804-5400. That's 210-804-5400, or visit the website tsaog.com.